Some of us like to clean out the house and organize that. Some of us like to freshen our look. And Dr. Manny Lopez is here with Lopez Plastic Surgery to talk about some quick procedures that we can really do during our lunchtime if we want, that will really give you that fresh face, right?
Absolutely, yeah.
And is that true? I mean, can you do a couple of these things on your lunch break?
There are so many fantastic things you can do now that can give you a good look. Because, you know, we're working. It's hard to get that downtime, right? To take time off, to have a big procedure. But there's so many things you can do now to give you that fresh look, natural look, and with no downtime.
Let's talk about Botox first. That's like the go-to product that everyone goes to. You know, it's been on the market for quite a while now.
80s, right?
80s, right? And I think more and more people are turning to Botox to get that quick fix. How long does it last?
Botox generally lasts about 3 to 4 months.
Okay, 3 to 4 months. And where do you put it when it comes to your face?
Kind of like you're seeing the video here, the best area, most predictable area to use or to do it is the periorbital area. So meaning between the eyebrows, on the sides of the eyes, like in the forehead, like you see me doing there on the forehead.
Now, how do you keep it from like bleeding and all that other stuff and puffing up so that you can go back to work?
Oh, actually, you know, with just a little bit of pressure, even the little bumps that you cause under the skin go away in minutes.
How much should Botox cost? Like if someone's telling me, you know, I can give it to you for $5 a unit,
right?
Should I worry? Because that's a little cheap.
I mean, yeah, exactly. So essentially, the way they do Botox, like you said, is by unit. So most people are now charging by the unit, and most people take about anywhere between 30 and 50 units.
Okay.
The usual charge should be somewhere around $10 to $12 a unit. So you're talking, you know, $300 to $500 per treatment that lasts about 3 to 4 months.
That's not too bad.
Not too bad, because it really
isn't.
is a little fountain of youth. What shows age, especially, you know, when you're talking and we're looking each other in the eye, are lines around the eyes. And so it really can make a significant difference.
Another option is Sculptra. What's that?
Yeah, so Sculptra is a filler. Now, there's two types of fillers. There are these volumizers that you see instant results. You put volume in, and you see the improvement right away. Sculptra is a little different. Sculptra is a stimulator, and so what it does is it actually causes your body to produce collagen. So as we age, we kind of have some atrophy or loss of soft tissue or collagen. And so by putting Sculptra in there, you're now stimulating your body to produce collagen. And
she doesn't even flinch.
No, because I do, I do numb her beforehand. I draw on her, and I'm just placing the collagen underneath the skin. And what that is doing, over time, you will get improved appearance because you have more collagen.
And I like that over time thing, because you don't go back to work and be like, whoa. You know,
totally
it's something that's gradual.
Very gradual,
and so
very
it's very
natural.
natural.
Absolutely.
And how much should something like that cost?
That's on the more expensive side. That's usually about, per vial, is about $700 to $900 a vial. And it can take anywhere from 3 to 6 vials.
Okay, and how long does it last?
Sculptra, after your sessions, because it's done in 3 sessions, should last you about 2 to 3 years.
Ooh.
So that's pretty cool.
Well worth it.
It's pretty cool.
Now, let's talk about chemical peels. I've always wanted to have a chemical peel because I always feel like I have so much yuck on my face that I could get rid of, but I'm worried about the downtime.
Right.
Is it? I mean, weeks? What are we talking?
You can actually determine how much downtime you have by the depth of peel you do. And trichloroacetic acid is a peel that I use very often because I can gauge how deep I go.
And you just smooth it on the patient's face. You do this in your office.
So it's just in the office with no anesthesia, just placing it on the skin. And there's different layers. You can go to pink, red, white, and then very white. And as you go very white, that's a medium depth peel. But if you go pink, like we did in this patient, he's back to work that afternoon.
Really?
Yeah. Now, you're not going to get as much of an improvement as if you were to do a deeper peel, but if you do that every 3 months or so, you'll get a nice enhancement of your skin.
Your skin will be like a little baby booty, right? It'll be nice and fresh. Well, thank you so much for coming by today. All sorts of great options out there when it comes to skin care. Check in with someone that you trust. Dr. Lopez is a board-certified plastic surgeon with Lopez Plastic Surgery on Sonterra. Go to lopezplasticsurgery.com or call to make your appointment at 495-5771. Again, 495-5771.